Okay. So this is probably the first of more than one December COVID update. And I know probably all of you who are watching this have also been watching the news, and the word you're thinking about is Omicron. But we're going to get to that in a minute. First, you know that around the world, particularly in Europe and in some places in the United States, we're having another surge of coronavirus, the Delta variant. And winter typically brings people indoors more and exposes them, particularly the unvaccinated, are very, very high risk of infections. Then we have hospitals who are full and so forth and so on. We have had one senior Amity faculty member who has had both shots, completely vaccinated, who now has COVID. Well, what does that mean? That means that it is time for you to get your booster shot. If you have not had it, there's no question that the effectiveness of the vaccine, or if you had COVID and you're counting on that, with the antibodies from that, it drops off very rapidly, 4 to 6 months. Since most of the people at Amity got vaccinated early, because we are healthcare workers in a congregate setting, if you have not had the booster, you are at risk right now. So the thing I want to tell you is, once you finish watching this fairly brief video, pick up the phone, make an appointment, and go get your booster shot. This is to protect you, to protect your family, to protect your coworkers, to protect the students. So please don't hesitate. Go and do it now. You may have, you're watching the news, you're saying, well, maybe it won't even work against this new variant. The person who was just infected last week was not infected with the new one, infected with Delta, which is still the dominant variant, at least for the moment. So please don't dither, don't rationalize. Go get your booster shot this week. Protocols. The most effective thing, after you've gotten your vaccination, what is the most effective thing you can do to prevent being infected? Wear a mask. All those protocols we talked about last year, really, really important. Remember, where does COVID lodge in the body? Right in your nasal cavity. So, if you're not wearing a mask, you are taking a big risk. So masking is probably the single most effective thing against all the variants of this virus, because they all lodge in the nasal passages and incubate there. And so as people breathe out, it gets into the airways. And one thing we do hear about this new variant, it may be even more transmissible than Delta, and Delta was pretty damn transmissible. So wear your clean, disinfected KN95 or N95 mask, double mask in situations where you're really at risk, like you've got to be in a plane or public transportation. I'd suggest double masking, just to be extra cautious. When you're not at work, keep safe. Keep wearing your mask, social distancing, and avoid situations that are crowded, where there isn't very much air circulation and you are in proximity to other people breathing. When in doubt, get a rapid test. We're making them available. talked to Doug a couple days ago. We're going to make sure that those supplies are available at all of our campuses. So if you're in doubt, I was around somebody who was infected. I got 2 rapid tests just to make sure. So take advantage of that. This is, of course, not a policy, but I'd really suggest if you've got children and they are eligible for vaccination, get them vaccinated. People hesitate. They think, well, we really don't know. What are the long-term effects of kids getting vaccinated? Well, we do know the long-term effects of long COVID. And look it up. Go and Google it and look it up. It is not pretty. I think, at least I personally think, like the risk of not being vaccinated and getting long COVID, these terrible symptoms that go on for months and months and months. We don't know how long they go on. They may go on for years. That is not a risk I would be willing to take if I had young kids. So think about that. So okay, let's talk about Omicron. What do we know? The answer: not much yet. Probably within a week or 2 weeks, we'll be able to put out another video that will give you more information as we get more information. And of course, watch the news and the announcements from Dr. Fauci and from the Centers for Disease Control, because they are on this thing. You can tell the president came back from Thanksgiving and has had meetings all over the weekend. So they are really going to try and get in front of this thing to the extent that they can. What we do know so far, it really appears to be much more transmissible than Delta. And you know, Delta, when we were talking about this last year, Delta went in a month to being the dominant variant throughout the world and in the United States. In a month. I mean, it went from 1% to 99%. So if this is more transmissible than that, it's really transmissible. What we don't know yet is can it overcome the current vaccines? Somebody described this variant as COVID's hit parade list, which included a lot of the different variants that have occurred over the past couple of years. So it's really, really hard to tell. They're concerned about it because it could overcome our current, the antibodies that are produced by our current vaccinations. We don't know that yet. So I think the president said it's a time to be cautious. It's not a time to panic. So we don't know if it causes more severe illness. Some evidence that it may not cause more severe, but we don't know yet. And if we do need, I mean, the good news is that if we do need another vaccine, because of this new technology, where it used to take 4 years to get a vaccine, they think they can probably do it in 3 or 4 months, which is great. But during that period of time, we would really be back to square one in terms of every protocol that we throughout this thing. We would have to do it and double down on it. So again, what is the most important thing? Get your booster shot, wear your mask. These are probably the 2 most important things you can do to avoid getting infected and infecting others. And you know, just to finish this off, why is this happening? We've talked about this before. Wealthier countries have hoarded the vaccine, have not put the effort into getting that vaccine out and getting it distributed and getting everybody in the world vaccinated. And the only way we're going to stop this thing is to do that. Everybody's going to have to be vaccinated. Also, because in wealthier countries like ours, we still have 60 million people who are not vaccinated. And those are probably the same people who are very resistant to wearing masks. So as long as this virus is in circulation, we will have an endless supply of new variants that come out that will pose a threat to all of us, even those of us who are being responsible and are getting vaccinated and are wearing masks. So I hope, and I'm sure all of you hope, we get our act together globally as well as nationally on this. The other final thought is, look, at Amity we've done pretty well in terms of we've jumped on this thing immediately. We've tried to get out really good information. We've provided the prophylactic things, vaccines, masks, and so forth and so on for everybody, with rapid tests, as much as we can do, as a result of which we have been relatively, I think, quite successful in preventing our students and our faculty and hopefully their families and friends from taking the brunt of this virus. But believe me, we are not out of the woods. Our hospitals are filling up. A lot of places are in our country are saying we are thinking about rationing care again, which means that there will be people who will die in the corridors of hospitals because there's no ICU beds available because people are not taking this seriously. Let's be on the right side of history in what we do in terms of this virus. So be safe out there. Please, right now, pick up the phone, make the call, get your booster shot. As soon as we have more information about the Omicron and what we need to do in terms of that, we'll get out another video to you, as well as Doug will probably send out more information via email. But remember, the thing that is the best prevention for all variants of this virus, wear a mask, okay? Okay? Thank you.